thing that bothered me the most was the fact that I was chopping wood one Saturday, and by the following Friday, I was barely able to walk. I knew that there was something very serious wrong with me. I was referred to Dr. Perez Cruet at the Michigan Head and Spine Institute.
John came to me because of an inability to walk. He was wheelchair bound. He had noticed over months that he was getting weaker and weaker and weaker. And initially he felt it was because of his lower back. He had severe lower back pain. And he had been struggling with that for quite some time. When I initially saw him in a wheelchair, I asked him, are you just weak in your legs? And I found on examination that he was also weak in his arms. And although his MRI of his lower back looked very bad, he had a severe multi-level lumbar stenosis. He had symptoms of what we call myelopathy. His reflexes were brisk. He could hardly stand. His arms were weak. And so we did a MRI of his neck.
I can remember him looking at the MRIs and saying, and I knew that it was probably more than a simple little operation.
We usually go from the head down. If they have compression in the neck, we address that first, and then at a later date, once they recovered from that, we then treat the lumbar spine.
Come to find out that I had some fairly serious problems in my neck as well as my back.
He actually was found on a CAT scan to have bone compressing the spinal cord as well as a herniated disc. So in order to treat this patient properly, you actually have to do what's called a corpectomy. You actually have to remove all this area, and then in its place we put an expandable cage, and we actually fill that cage with the patient's own bone.
We went into the hospital on the appointed date for the operation on my back, and he said the neck needs attention quicker than that does, so we went in and had the neck surgery instead.
We removed the disc above and below and the vertebrae, and the bone that we removed is filled inside this cage, and then we put this plate that is right in front of the spine, secured by screws. You can see the little break in the plate allows for compression of this titanium cage, and that promotes bony healing or fusion.
About 6 weeks later, he operated on my back.
And what you see here, he's got severe compression at the L4-5 area. We do a minimally invasive laminectomy first, taking away the compression of the nerves or the cauda equina. Once we do that, we go into the disc space, restore the disc height. We take that bone from the surgical site and actually inject it into the disc space. So John's prognosis is excellent. He is 72 years old. He's had a severe spinal cord compression in the neck, as well as compression of the nerve roots, or what we call the cauda equina, in his lumbar spine. He is starting to walk independently, but it is going to take time.
My second surgery was about 6 weeks ago, and every day, as crazy as this sounds, something is a little bit better than it was the day before. Whether it's the strength in my legs, whether it's my balance, or whether I can lift my toes up.
He continues to make excellent progress. I'm hoping within a few months he'll be independent of a walker and a cane.
We went in for a post-operative meeting with him about 2 or 3 weeks ago, and he was very pleased with how well things had turned out. And obviously I'm twice as pleased as he was, because it's worked out well for me.